Purdue Pharma, based here in Stamford, Connecticut, is often identified as the originator of the U.S.'s opioid epidemic, and it's never been easy to hold them to account. The company pioneered the aggressive marketing of opioids with the release of OxyContin in 1997. Up until then, such narcotics, derived from the opium poppy, were reserved for cancer patients and palliative care.
The rate of addiction amongst pain patients who are treated by doctors is much less than 1%.
The company courted doctors eager to treat chronic pain with assurances that opioids were safe and non-addictive. Financial incentives were also offered. Other pharmaceutical companies also followed this strategy. And soon opioid sales rocketed in the US. But so too did opioid deaths. 10 years ago, Purdue Pharma finally admitted it knew its drug wasn't the miracle cure for pain it said it was. It paid out $600 million in fines. But as of last year, the company is estimated to have made some $31 billion from the drug. States around the country are suing the company or exploring legal action.
Well, this is a public health crisis. There's no bigger public health crisis in the United States right now. It's not just about getting a paycheck for the state. It's about rehab for people who are addicted to drugs, and also the kind of education and reforms that would hopefully prevent a surge like this again.
Not only does Purdue not want us filming anywhere near its headquarters, it also declined our request for an interview. However, the company did release a statement which said in the US it is committed to working collaboratively to addressing the opioid crisis. But even as opioids face scrutiny in the US, OxyContin is going global. In May, 12 members of Congress wrote to the World Health Organization with this warning. The greed and recklessness of one company helped spark a public health crisis in the United States that will take generations to fully repair. We urge the WHO to do everything in its power to avoid allowing the same people to begin a worldwide opioid epidemic. The WHO has yet to respond to the letter, which has Congresswoman Marcy Kaptur concerned. One county in her state of Ohio leads the nation in per capita U.S. opioid deaths.
I would say do not let these medicines be used in your country. I don't even want to call them medicines. Do not let these pharmaceutical products be used in your country without very careful review and tight control.
OxyContin is already being marketed as an internationally proven low-risk treatment for chronic pain to doctors and consumers globally.
We know that effective medicine can change the world.
But US politicians are warning the world to be vigilant. Shihab, Rattansi, Al Jazeera, Connecticut.